an introduction, but just to say I'm a BCNH graduate, and I established IBS clinics in 2010, and I've been a full-time practitioner for 10 years, and I employ 3 other nutritionists, and we work together very closely as a team. And we were just talking earlier on the table this morning just about the power of collaboration and how important it is to share your stories and your experiences, good and bad, with other nutritionists, because we can all help each other out and we learn from each other. So I think that's really very important. And then this year I've taken a bit of a plunge and I'm doing a bit of Sibo and gut health mentoring myself. And I've got a little group of people now, and we are kind of halfway through my little Sibo course. And I'm really enjoying being involved, kind of coaching them and talking them through the vagaries of Sibo, which is one of my passions in life, which is probably a bit sad, but there you go. Okay, so my first case study, let me introduce Hayley to you. So Hayley is 36 years old, and before I met Hayley, my secretary said to me, "Oh, you know, you're seeing Hayley this week. She's been relentless at trying to speak to you. She was quite overwrought on the phone and don't really know what you're going to be getting when you meet her." So I waited for this lady to turn up, and the first thing that hit me was that she is, well, she's actually an ex-model, so she's a very striking looking lady, but she was clearly in quite a lot of distress, and she was really concerned about her loose bowels every morning and lots of gas and lots of bloating. And although this doesn't sound like a really dramatic thing, it was really having a big impact on the quality of her life. And she was very anxious, very low about things. She was turning down invitations to go places because she wasn't sure how she was going to feel. And it was affecting even things like her confidence, which, you know, naturally she should have been quite a confident lady, but she'd got to a point where she was seeing fewer people, she wasn't going to the gym anymore, she kind of got it in her head that she didn't really fit in where she lived, and so she was really in a bit of a state. And in fact, she spent most of the consultation in tears, which, you know, me meeting her for the first time was kind of a bit of a surprise. So as well as the anxiety, she felt that she had lots of mood swings. Her PMT varied from being okay to being really bad when her gut was playing up. And there was quite a long history with this condition. The early signs of her irritable bowel began 15 years previously. And bear in mind, she was an ex-model, so she, of her own volition, she told me that she spent a lot of time avoiding eating food. She would do funny, faddy diets. You know, a lot of the models exist on, you know, one sandwich and cigarettes for a whole day in order to kind of keep their weight down and keep a certain look going on. So she said, you know, she had a really uncomfortable relationship with food. She hadn't looked after herself, and it hadn't been a problem for a while until, I suppose, going through the aging process. And actually when she stopped modeling and then she met her husband and she had children, then it became a much bigger kind of issue. And she'd spent actually quite a lot of time meeting other practitioners, and she'd done several interventions over the years. She'd already discovered the FODMAPs diet. She'd done a food sensitivity test with Lorisian. She had taken probiotics, digestive enzymes, stomach acid. She had done like a biome stool test, and she had tried to implement a lot of these things for herself, but generally nothing really held for very long. In her background and her medical and surgical history, she had an allergy to nuts, which seemed to begin in 2009 after she was stung by a jellyfish on holiday. She had noticed that she'd got problems with cashews and pistachios, which are high FODMAP nuts, which made me pick my ears up. And she had hay fever kind of kick in at 25 years of age, where previously that had not been an issue. She had 2 children born by C-sections in 2013 and 17. And she had this protracted stress going on. She'd been backwards and forwards to the GP. The GP had tested her for celiac disease. Every time it came back, it was negative. But she really felt she got a problem with gluten because she didn't feel good when she ate it. So with all of that going on, and I decided that we needed to do some testing, and so I ordered a GIFX and a Sibo breath test. And these are some excerpts of her GIFX, the first stool test that she did. So we can see straight away from the top panel, which is obviously a summary of this report, that she had a parasite, so she had D. fragilis. There was no inflammation, no pancreatic insufficiency. In fact, her elastase was really very nice and high, but she did have quite a lot of imbalance. So she had some pathogenic bacteria. She was low on embutyrate and short chain fatty acids in general. So here we can see what her report looks like. An important point to note is that her SIGA is absolutely undetectable, so completely on the floor. So what we know about that is when you've got very low secretory IgA, you're more likely to have food sensitivities, because one of the things that secretory IgA does is tag foods as acceptable to the immune system. So clearly that's not going on. And also she's got very little in the way of defense. You know, how is she going to stop parasites and other pathogenic bacteria from, you know, moving in and taking up residence in her? She's going to have very little capability of doing that. So another important aspect here is the Bacteroides phylum were all very elevated, and this is a typical scenario when someone eats with a Western diet. So generally, if someone is eating a lot of animal produce, saturated fat, and not having enough vegetables, then you're going to see more of the Bacteroides phylum dominate in a stool test. And we can also see that her bifidobacterium was quite low, although her lactobacillus is surprisingly high, but I think that she may well have been supplementing as a prelude to doing the test. So on culturing the test, we can see that lactobacillus failed to thrive at all. It was actually a no growth. And her bifidobacterium also was very poor at just a 1+. So we've got quite a dysbiotic situation showing here. And then she's also got a couple of potentially pathogenic bugs, which is the Klebsiella and the Citrobacter frundi and the Enterobacter cloacae. So what we've got there is a bunch of bugs which are pro-inflammatory and opportunistic by nature. And then we've got obviously the D. fragilis that showed up. Because I did the GIFX test, we got this useful sensitivity panel. So we can see actually that the Citrobacter, the Enterobacter and the Klebsiella were all somewhat susceptible to plant tannins, but also quite susceptible to other things like berberine and oregano, which you're probably all using yourself in clinic, myself included. This is her Sibo breath test. Not terribly exciting. She's just got 5 parts per million of methane at the outset, no residual hydrogen. And what I've put here is, so often when I see this kind of test come up, the important thing to note is that you only need 3 parts per million of methane generally to have some impact on the motility of the gut. So she's not constipated, but you can sometimes find that someone will be constipated even though they've got low levels of methane in this, like this. So what's going on? What did I think was happening? So clearly we've got a parasite, we've got deficiency dysbiosis and a general lack of abundance and diversity, low levels of bifido and lactobacillus, which we know are friends, are bugs in the gut that help to prevent other bugs from overgrowing. And you've got some potential pathogens, Citrobacter, Klebsiella, Enterococcus. Now, Citrobacter, Klebsiella, they are hydrogen sulfide producers. And that made me kind of make a connection with the methane Sibo, because what was really odd was that she's got this kind of diarrhea and this kind of urgency presentation, but she's got a bit of methane showing up in the Sibo breath test, and that normally kind of slows the gut down. But hydrogen sulfide is actually very much associated with speeding up the gut and is associated with diarrhea. So I think it's possible that we may have maybe a deviation of some of the hydrogen produced by bacteria in the upper gut towards the sulfur reducing bugs, which we saw in the stool test. So she had actually very high desulfovibrio, which I'll show you on the next test. So just to recap, this is her stool test results, and we can see here that actually she's got D. piger, which is a very renowned bug for producing hydrogen sulfide in the gut. So it could very well be the case that we've got some of the hydrogen from the bacterial fermentation is actually being handed off to the SRBs that are turning into hydrogen sulfide. The hydrogen sulfide is a gas that is produced naturally in the gut, and it's not fair to say that it's a problem, because we do need it. It's an important signaling molecule and has lots of functions in the gut, but it's a problem, like most things, if there's too much of it or it's in the wrong place. High hydrogen sulfide is associated also with inflammatory bowel disease, and particularly ulcerative colitis. And in fact, some of the dietary approaches for ulcerative colitis can include a low sulfur diet for exactly that reason. One question I do ask of a lot of my patients is, particularly when they're bloated and gassy, it's, you know, when you're flatulent, is there a smell to your windiness? And she said that she could smell rotten eggs on occasion, and that for me, it is kind of evidence that there might be something sulfurous going on, and make me think that hydrogen sulfide might be a feature. This is actually a nice kind of schematic that I found, and this just shows what happens in the gut with complex carbohydrates coming in from the right-hand side there, basically being progressively fermented by our friends, Clostridium rosibera, which actually was low in her test, converted into hydrogen, and then handed off either to the sulfur-reducing bugs, or actually our friends, the archaea, which convert hydrogen into methane. So the other thing I wondered about was histamine intolerance. Because she had this kind of late onset of hay fever, and also that she told me about a diarrhea episode following a meal out where she'd had a 28-day aged steak, and she drank quite a lot of red wine, and that generally red wine and alcohol seemed to be a bit of an issue for her, and that she found that these kind of complex meals and these kind of event type things often gave her loose bowels. So the other thing about Hayley was that she had this incredible anxiety. Remember, she was in tears all the way through the consultation. And so what I see all the time with irritable bowel syndrome, it's about, I would say 40% of the people that I see with IBS will have some form of anxiety or depression, or some kind of mental issue, psychological disorder. And so this is just basically a schematic which just describes this two-lane superhighway that goes between the brain and the gut, and the gut and the brain, where they can communicate with each other. And if you like, I always describe it with patients that it's like the gut and the brain can wind each other up. And in many, many times when I've been talking with patients with IBS, they describe situations where they're worried about taking the kids to the theatre or going to the sea for the day because they're not sure if they are going to know where the toilets are, and then they're worried that their bowels are going to misbehave, and then invariably that's what happens. And so the way that I always tell them that we work is that what we're going to do is try and stop the negative messaging coming from the gut, and try and work on the brain simultaneously, and just calm it all down, calm the messages down. So this is quite a nice diagram that kind of shows how that happens. So what did I do with Hayley? So the first thing that I did was talk to her about finding some me time. So although she didn't work, her background was that her husband and she were doing an extensive rebuild of her house during all of this time, which is pretty stressful. She also had 2 young children that were under the age of 5. Now, I don't have children myself, but I understand that having 2 children under the age of 5 can be a bit stressful. So she had quite a lot of those kind of pressures going on. And she's a very type A personality. She's putting a lot of pressure on herself to be perfect. And what she wasn't doing in all of that day, she spent the day frenetically busy, running around doing all of these things, dealing with the builders, sorting out her husband, running around after the children. She wasn't taking time out for herself. And I thought that was really very important, that we try and give her that breathing space. And I also wanted her to do some appropriate exercise. And I didn't want her to go to the gym and just kind of thrash herself and make her exercise be a stress on the body. I wanted her to do something a bit more restorative. I wanted her to balance off some of the high intensity stuff that she was doing with maybe some yoga and some deep breathing, some Pilates, that kind of thing. And, you know, she got a little dog as well. So it's like, get out with your dog, get out in nature every day, really important. So the other thing I talked to her about was meal spacing, and I wanted 4 hours between meals and a 12-hour overnight fast. And although this is kind of advice I give with Sibo patients, I often do this with irritable bowel as well, because I think it's really important to give the gut a break. And this kind of constant grazing, which a lot of people do, I think is a real problem, because I think it's very pro-inflammatory. I don't think the gut gets to clean itself down properly. We know it affects the MMC function, the migrating motor complex. So this is something that I always put in my programs when I'm dealing with gut health. So from a diet perspective, I was really wary because of her background with disordered eating and eating disorders. What I didn't want to do was demonize any particular food group. So I didn't want to use a diet which was clearly avoiding all carbohydrates, which, you know, a lot of the gut health diets that we offer often are like that. So I decided, although she'd done the FODMAPs diet before, I noticed when I asked her about it that although she was technically correct with the foods that she was choosing, she wasn't really following the spirit of the diet. And what I mean by that was that she might be eating for breakfast, she might just do eggs and bacon for breakfast, which is fine from a FODMAPs perspective, but you know, where's the colour in that? Where's the vegetables? Where's the life force? You know, what's she doing? So we talked a lot about the FODMAPs diet. We talked a lot about what breakfast would look like, what lunch would look like, what dinner would look like. And she was doing the usual mum thing where she wasn't really worried about herself during the daytime. So she'd run around, just grab a bit of something, anything, even if it was a biscuit, or she's out for a coffee with a friend, she'd eat a muesli bar, you know, from Cafe Nero or something. So she wasn't really thinking about her health and her diet in any great way. So I really felt with, you know, showing her how to do FODMAPs properly, that we could do that for, you know, a relatively short space of time. And I thought what we would do would be to do 2 weeks really quite strictly with FODMAPs to get some symptom control, and then we would start the reintroductions. Because what I know about working with the FODMAPs diet is, remember, we've got those 5 classifications of different types of carbohydrate groups, but very few people have really got a problem with every single group. And that means that if you can reintroduce, you can actually just get them probably just avoiding a couple of things. It might just be that dairy is the thing that they can't do, or maybe it's gluten. And we'd already got this inkling with her that gluten was an issue from her own observations. But I really wanted to kind of get on top of this kind of this morning urgency and just, you know, give her, I really felt that that would turn the corner from the point of view of her mental anxiety around it all. So the other thing that I'm really fond of is getting people to eat their colours. So, you know, we talk a lot, don't we, about eating the rainbow. So what I do is I give my patients, actually regardless of the diet that I put them on, this phytonutrient spectrum guide. And it's very, very simply, it's just a listing of fruit and vegetables by colour. And what I do is give them, they've got boxes here where they can tally off what they're having on a daily basis. And I try from every category. And this is kind of a really good way that even within the FODMAPs diet, that you're getting her to eat something out of every colour. So we did that. From a supplement program perspective, I gave her 6 weeks of digestive enzymes, because I still felt, even though her digestive enzymes looked pretty good, that there was still a value of helping her to digest and absorb properly, because I felt like a lot of the time she was eating, she's probably in some kind of invoked stress response. So maybe digestion wasn't always great. All of the bugs that she had were quite susceptible to plant tannins, so I went with Tanelbit as being a primary antimicrobial. I also included ADP oregano, which is my favourite antimicrobial of all time, and Alimed, because there was that element of methane. And what I've also seen lots of times with Sibo is that you can sometimes have a borderline Sibo test where you're not really sure if it's the Sibo at all. And then later on, actually, it can really kind of seem to have come out of nowhere. It can flare up or can show itself. I used a probiotic called Triflora because I wanted this mix of lactobacillus and bifidobacterium. And what I did was space it away from the antimicrobials. So I often put them in at bedtime. And I actually put in some prebiotic fibers. So there's a very nice product called XOS, which is a prebiotic for people that have got problems with FODMAPs. And I also included another favourite supplement, which is calcium magnesium butyrate. So I wanted to put some short chain fatty acids in, and these are just amazing product really. Helps to detoxify the body, clears ammonia out of the body, neurotoxins. I felt like because of the thing that was going on with the brain, I thought there was some brain fog and issues there, and I really wanted some butyrate in. And I also just wanted to try and encourage friendly flora. This is a paper that I found that actually talks about the gut microbiome and its influence on mental health. And what we can see here, and it's probably too tiny for you to read, but there are various strains of Bifido and Lactobacillus plus prebiotic fibers, which have anti-anxiety and antidepressant effects. So hence why I chose the Triflora product, because it does have quite a lot of these plantarins and rhamnos type products, which I felt could also be helpful for her. So how did she do? So the second follow-up, she felt so much better. We had no tears. In fact, she turned up with a big smile on her face, and that was, for me, that was such a relief to see her in a much better state. She described feeling much less anxious. She'd got herself, they had kind of finished their house build, and they were moving in. They were living somewhere else and they were moving in. She had had some gumption to go back to the gym, and she'd signed up for quite a nice gym in her area. And she felt like she got some exercise, she got some energy to exercise, and she was exercising. And she didn't feel intimidated about being there. She felt okay with it all and just okay with life in general. Her bowels had improved enormously. She was now experiencing normal formed stools 1 to 2 times a day. She did see a little bit of mucus on a couple of occasions, and she had been a little bit constipated. She'd noticed again from another dinner out that she doesn't handle fats very well. And she hadn't got around to doing the Sibo test that I'd asked her to do. She simply didn't get around to it. And actually, I think really she just felt like it wasn't really necessary, that she was feeling better. So we did a follow-up. I did a short form of the GI effects. So I did the GI pathogen test, really just to have a look, because I wanted to see if the D. fragilis was still there. And unfortunately, it was. So although she felt so much better, she'd still got the parasite present. But if you look, the biggest changes really were that Lactobacillus was now a 1+. Bifidobacterium had gone from 1+ to a 2+. So things were starting to change from the point of view of her normal indigenous flora. It looked like it was improving. And the Citrobacter and Enterobacter had gone entirely, and they were both a 4+ previously. The Klebsiella is now a 1+, and it was a 4+ before. But we did see some white blood cells, which correlated with the mucus that she saw in her stool. So at this point, I made a dietary adjustment to continue FODMAPs, but the reintroductions were well underway. So I made sure that I was really careful to check over the foods that she was reintroducing, and I upped the vegetable component of the diet because she was tolerating them well. For reasons best known to herself, I think she decided she was test the gluten theory, and she had a bowl of Weetabix one morning, just randomly, you know how sometimes patients do that. So part of me was kind of screaming, no, why did you do that? But on the other hand, I just kind of flipped it around and went, okay, so how did you feel? And I'm pleased that you did that, and I'm sure you did that deliberately so that you could feed back to me how you were feeling. And she said, well, I know from that Weetabix that I know that I can't go near gluten. So you know, if there was any avoidance of doubt, then she knows now that she can't go near gluten. So at this juncture, she told me, so if you look at the original test and the short form test, we could see there was a big improvement. So the only thing that was really still hanging around was the D. fragilis, which I felt on balance would probably go in time. But one of the things that gave me a bit of a curveball was the fact that she was going on holiday. And she said, look, I'm going on holiday, and I'll be honest with you, I don't think I'm going to be as good with my diet when I'm away. And I'll take all the supplements, but I am going to have a drink, and you know, I'll try and do what I can, but you know, we're staying in this hotel, and you know, and I might want a pudding, and I felt a bit like, oh, okay. So I elected that we would continue with the antimicrobial program for a bit longer. We would do that for 4 weeks, and then what we would do would be give her a break from the antimicrobials, and we would support her with a prokinetic and continue with the triflora. And that was basically what we did. So the next time that we tested, unfortunately, we had a situation actually on the plus side. The defragilis had gone. So now the parasite disappears. But in its place, we've got, it's like a revolving door. We've got 2 strains of Citrobacter at 4+. We've got low short chain fatty acids. Her secretory IgA is still on the floor. And now her pancreatic elastase has gone from being really good to being really poor. But the parasite's cleared. So if I reflect on this case, I just think, but for her holiday, I would have done more of a restorative rebuild and repopulate phase. But because she was going to be on holiday and because we were so worried about her picking up some kind of infection, I wanted to leave her on some antimicrobials as a prophylactic when she was away. But now it's almost like things have kind of gone too far. It's like I've kind of over-treated, you know. So what we're doing now is, she also did a follow-up breath test, which was quirky and weird. She had a high methane at baseline, which when it's at baseline and you don't see a rise following the lactulose solution, you need to conclude really that it's probably colonic in origin. But the test was kind of odd. There was still no constipation. She just had normal form stools. So I kind of have not really acknowledged too much about this test. I just think it's kind of a quirk. So at this point, we've done all of the reintroductions of the FODMAPs. She's permanently avoiding gluten. She's continuing with the meal spacing. And I was feeling a bit perplexed around, you know, why is her indigenous flora, why is it so poor? What's going on? And we were talking over her diet and she was describing what she was eating, and you know, she eats like a nutritionist. I was thinking, what's going on? And she said, yeah, all I do is I just have a glass of wine with dinner every night. And I thought, that's it. There we go, that's it. So after a bit of delving, I realized that it was more like a glass and a half of wine every night, and she's doing it every night. And at weekends, it's a bit more than that. And you know, what we know as nutritionists is that alcohol has a terrible effect on the gut and a terrible effect on gut flora, which is what I told her. But I also realized that the glass of wine was really about kind of a ritual that her and her husband he comes in from work, they cook together, they have a glass of wine, they chat. So it's more about the whole ritual rather than actually what she's drinking. So what I suggested was that she would stop the wine and swap for kombucha, because then she can have a glass of something, he can drink what he likes, she can have a glass of something, and she's putting in actually some beneficial strains of flora in. So that's what we're doing at the moment. A new supplement program is a bit more about the rebuild and support of her indigenous flora and her secretory IgA levels, which we've really got to try and bring up. So she's still on some digestive enzymes. I put in now Biodos 7+, which is 7 strains of beneficial flora plus prebiotics. Continuing with the butyrate, and I've also put in some Securil, which is a different type of short chain fatty acid. We're doing high dose Saccharomyces boulardii, and we're doing dairy-free colostrum. So what we're trying to do basically is just support our innate immune system and try and engender a more beneficial flora. So this is in her own words. So regardless of how I feel about her new test results, Hayley's actually thrilled because she actually feels really well. And she said, direct quote, "I feel my tummy is getting stronger, my anxiety is gone, I feel confident and happy, and I'm more like me." In her new house, she'd had this large family Christmas, and she felt great. She said, "I was the hostess with the mostest, you know, I was really cool with everything, everyone was really chilled," and she said, "I couldn't have thought of doing that a year ago. I would have felt, you know, there's no way I could have done it." There's still the odd hiccup. So she doesn't tolerate heavy meals out. So the steak, red wine, dessert, I still think there's a histamine aspect. I also think that there might be an issue around saturated fat as well. And the glass of wine with dinner, she has willingly embraced the kombucha idea, and she's actually found a kombucha which is called Royal Flush, which apparently you're supposed to drink out of a champagne glass. So, you know, for her, that's perfect. And hey, you know, whatever it takes. And so we're continuing to work on her dietary diversity. So I'm kind of seeing her, you know, every sort of 8 to 10 weeks at the moment, now seeing her husband as well. But she really is a very different lady from the one that I saw originally. So sometimes, you know, you can't always think that a test result is the thing that you base all of your thoughts on around how you're going to approach someone. And she's feeling so much better. I'm confident that in time we will turn the corner as far as getting her indigenous flora back to where it needs to be and raising her secretory IgA. But, you know, she had years of disordered eating. So, you know, this is a relatively short space of time to try and turn things around. So we have to be reasonable. But, you know, the most important thing is that the things that she came to see me for are well on their way to being sorted. So that's Hayley. I have another case for you. So this lady is Amanda. She's 55 years old. Again, another urgent diarrhea, cramping and pain in the abdomen, and particularly bad after breakfast. When I talked to her about this, I said to her, has this always been the case? You know, you get this urgent diarrhea. And she said, well, no, she's actually, my default is that I'm normally constipated, but in the last couple of months, I've been getting this kind of urgency to go, and now I'm much more a diarrhea person than I've ever have been before. So of course that prompts the inevitable question, you know, what's been going on in your life the last couple of months? And it turns out that her dad is very ill, and she's backwards and forwards to the hospital. She's very stressed, they're very close, and she's really obviously very anxious about that whole situation. So as well as having IBS and this urgent diarrhea and this cramping and pain, she's also experiencing some sinusitis, some asthma, bursitis. Her GP suspected that well, we know she's hypermobile, and her GP thinks that maybe she's EDS. And if anyone knows anything about Ehlers-Danlos syndrome, you can often find Ehlers-Danlos syndrome in conjunction with POTS, which is a postural hypertension issue, and histamine intolerance. And she's quite overweight. And when I look at those conditions, you know, we've got a couple of itises, which are obviously inflammatory situations. We've got asthma, and I always think about asthma and dysbiosis. So pretty much straight away, I'm thinking, oh, there's going to be something going on in her gut for sure. Her IBS actually began age 38, and she was also getting panic attacks earlier than that when she was 30. She had a history of croup as a child and asthma in childhood. So when I look back into the history of her, she'd also had lots of antibiotics as a child as well, and her mum was also an IBS sufferer. She'd had some surgical procedures, and here they're all listed here, but we've got various things that are associated, I think, with kind of collagen type things as well. So that might be part of the EDS picture. So with Amanda, I ordered a GIFX, a Sibo breath test, and an advanced thyroid with vitamins. So this is her GIFX, and we can see that there's nothing in the infection column. She's got very elevated secretory IgA, so like her immune system's really fighting something, and she's got a potentially pathogenic bacteria and low levels of beneficial flora. Yeah, and her SIgA is kind of the high end of normal in here. Her short chain fatty acids look okay, beta glucuronase looks all right. Again, we've got this kind of Bacteroides cluster, which obviously is synonymous with the Western diet. And otherwise, not too much to see on that page. On culture, we can see that actually her lactobacillus was non-existent, and so was her bifido was non-existent as well. And in the additional bacteria category, we had a new bug on me, actually, Serratia maricens. It sounds very exotic. On doing some research around this bug, it seems that this is thought to be opportunistic bacteria. It's very pro-inflammatory. It has a tendency to promote diarrhea, so that would connect. It's actually a hospital-acquired infection, invariably. So I did wonder whether visiting Dad in hospital meant that she'd come into contact with this. And it also promotes inflammation by upregulating interleukin 8 as well. So very kind of nasty inflammatory thing. But it's nice and susceptible to berberine and plant tannins and uvauracil. I Sibo test everyone, by the way. So we did a Sibo test with her. And remember, she wasn't constipated because I think the Serratia was kind of doing a bit of overstimulating her gut, but her default is towards constipation. So I did wonder about whether there was some kind of low-grade SIBO that had been going on already. This is her advanced thyroid. The reason for this actually was really around thyroid function. She talked about her difficulties losing weight, and also she's a lady of a certain age where she'd be more susceptible to things like Hashimoto's thyroiditis, so it seemed sensible to screen for this. And I also wondered about this kind of background history of constipation, whether there was a sluggish thyroid. But as you can see, the thyroid function looks quite good. You know, it's really even optimal. So the only thing that this really picked up was that there was a low serum folate. And obviously folate comes from foliage, comes from leafy greens or uncooked leafy greens, which she wasn't getting a lot of. So how did I interpret all of this? So these are the key findings. And here's what I did. So again, the stress management measures. This is something that I do more and more of now than I ever used to. I always look at someone's exercise, I look at their sleep, I look at deep breathing exercises, particularly before meals, I look at mindfulness. I really try and encourage people to get out of this kind of fight or flight mode that many of them are locked into. And again, I incorporated the meal spacing, the 4 hours between meals and the 12-hour overnight fast. From a diet decision-making perspective, weight loss was something that was really quite desirable. She needed to lose 16 kilos in order to give her a BMI of 24.5. So we had a bit to go. And I'm really aware that, you know, people that are overweight, they're inflamed people, generally speaking, as well. So it made perfect sense to me that we would try and get some weight off too. So the diet that I chose was actually a diet that I use for SIBO quite often, which you're probably all familiar with, which is the Biphasic Sibo diet, which is actually a specific carbohydrate diet overlaid with FODMAPs. So phase 1 of that actually cuts out all carbohydrates. There are no grains, no breads, no cereals allowed in that at all. And I felt that that would be a really good thing to get control, but also maybe to kind of kick off some weight loss, which I think we needed some positivity, you know, a good story. Again, with her, she got my Phytonutrient spectrum guide because I really wanted her to eat lots of colour. And her supplement regime included berberine, oregano, alimed, butyrate, lactobacillus PRS, Saccharomyces boulardii, and a multivitamin for women. And the outcomes were IBS symptoms better overall, no episodes of urgent bowel movements and diarrhea. Bowel movements were normal, actually a bit too firm, so there's no pleasing some people. No abdominal pains, but she was still getting some bloating, but to a lesser degree. Her asthma was calmer, but as she's sensitive to tree pollen, we concluded that actually maybe it was down to the fact that there was less pollen in the air at that point. She'd lost some weight, but the weight loss had leveled out at just 1 stone and seemed to have stopped still. She'd done a well woman checkup at the GP surgery, and her cardiovascular risk was considered to be 1.5%. And although her cholesterol was high-ish at 6.5, she had good levels of HDL, so that was not too much of a concern. She followed the biphasic diet very closely when she was at home, and she'd avoided alcohol, and she only had occasional treats, which she said was a mouthful of cake or half a scone, which I would think is probably a slice of cake and a whole scone. But her father died as well, so things took a bit of a downward spiral for a while. And, you know, understandably, wasn't a priority for her to be on the diet when everything was going on with her dad. She also found with everything that was going on around her dad and the funeral that she was forgetting the supplements, and she found it a real struggle actually to do the supplements in the middle of the day. And also she just found that, you know, too many pills and hard to swallow, and she just kind of got out of the loop on it. So what we did was we had a really nice kind of follow-up session where I said to her, you know, do you feel ready now? You know, it was a few weeks after her father's death, and she felt like now is the time to take control of my health again. I want to get back on board. So we had this really good chat, and I said to her that if I amend your supplement program, why don't we put in a liquid antimicrobial? We can do a 2-a-day dosing at breakfast and dinner, so you haven't got to worry about lunchtime and taking pills with you. Can we make that work? And she's like, yes, I'll certainly give that a go. So that's what we did. And then we did her follow-up GI effects. Her secretory IgA is still somewhat elevated, and butyrate is still lower than I would like it to be. But her Serratia, I thought I had it on there, had disappeared. Her IBS had improved again, and her urgency in the mornings and her diarrhea was just a distant memory. The asthma was calm, again, probably because of the time of year, and her weight loss had restarted. And it was slow, but it was consistent. And she has, she's lost a bit more now, but at the time of writing this, she'd lost 23 pounds, and she wants to lose another stone. And actually looks really well on her. She looks bonny, you know, and she's very positive. She followed the Biphasic really closely, and even when she went away on holiday, so this is how her mindset shifted, that she made it work even when she was on quite a swanky holiday. She's now following phase 2 of the specific carbohydrate diet and biphasic approach, and she's finding some time to experiment with some new recipes and some meals, and she's really got on very well with the biocidin and found that really helpful. So that's my 2 case studies. And I think I might have, Alex, a little bit of time for questions if anyone has it. Yeah, I've got 15 minutes if anyone has got any questions. Lady at the back. With Sibo, I will retest every 6 to 8 weeks. With stool testing, probably every 3 to 4 months. Because I think earlier than that, then it's too soon. And I will often, following antimicrobial program, I'll do a period of consolidation where we try and support the innate immune system and put in some probiotics. The idea being to try and crowd out any of the straggling bacteria or errant bugs that are in there that are still, you know, hanging around. Welcome.
Sorry, just before we take some more questions. Yes, please put your hands up. With these mics, they're linked to everyone who's listening via the webinar. So if I could ask everyone kindly with a question, just wait till you've got a mic in your hand. Otherwise, people on the webinar don't hear how Tracey's answering. Thank you. And apologies if I seem like I'm not picking anyone on purpose. It's just me right now.
Do you find that people don't tolerate biocidin that well?
I don't find that, but I think it's really important with biocidin. If they don't tolerate it well, my instinct is that biocidin is an incredibly effective antimicrobial, but it works against everything. So it works against Lyme disease, it works against yeast, works against bacteria, it's effective against parasites. So sometimes you're inhibiting more than you realize. So you might have only tested for a couple of things, but actually you're doing a much broader job. So what I like about biocidin is that you can buy it in capsule form and you can buy it in a drop form. And 1 drop of biocidin is equivalent to 1/3 of a capsule. So someone could taper gradually over time, and that then I find is very well tolerated.
And just one more. What other biofilm disruptors do you use?
What other
biofilms? So would you use like serrapeptase, for example?
I have used that, serrapeptase. I quite like NAC. I quite like proteolytic enzymes taken away from food. I think that is actually quite a cost-effective and very good solution for most people. So I tend not to use many of the biofilm busting products simply because I think that they're expensive for what they achieve. And I think you can use enzymes in a much cheaper way. Oh, sorry, just want to wait for the mic. I'll just take that lady if that's okay, and then that'll give them the time to come to you with the mic. Thank you.
Hi, Tracey. I wanted to know why you mentioned that you just overall test everyone for Sibo.
Well, because my business is predominantly irritable bowel syndrome, and studies have shown 60 to 84% of people with irritable bowel will have Sibo. So I consider that I need to rule it out for pretty much everyone that I see. And I also find that even though someone might not present with it being a typical Sibo case, more often than not, they have it.
Thank you.
So, thank you.
I'd like to ask, do you ever use fluconazole antibiotics for treating yeast and candida overgrowth when it's kind of serious, or do you prefer to use ADT or with the enzymes or any other microbiome?
Yeah, good question. As a nutritional
combination?
therapist, I don't have ready access to antibiotics and antifungals in a conventional sense. I definitely have some patients that have a private GP or a GP that's prepared to prescribe. And my take on things like fluconazole is that when you've got a candida infection, the best way of clearing it, or the only way that you can clear it and keep it gone, is to keep up a more lengthier plan of attack against them. And I think with candida in particular, it's really important to support the innate immune system in the first instance. And I think that often GPs will give 1 week's worth of fluconazole, or someone will buy it over the counter in Boots or something. I just don't think it's enough. I think it's just a tip of the iceberg, really.
But if you do already following very restricted low carbohydrate diet, and you do low food diet, and everything is perfect from a nutritional point of view, and it's still kind of present and cause a little bit of difficulties, would you still give it if you have the chance of giving fluconazole? Would you?
I don't think I would, for the
You would
simple
not?
reason that I've never had a problem clearing candida.
Okay.
So, and I would use things like caprylic acid. I get on very well with that. Paramycrocidin, which is grapefruit seed extract, and Saccharomyces boulardii, supporting the innate immune system. And I've found that that works, very effectively. And I also don't do very, very low sugar diets either. So I actually think that's counterproductive. And also, one of the things that I'm very cognizant of is that candida can live really well on ketones. So you don't want someone that's so low sugar and so low carb, because then they're going to be ketone rich, and candida can do quite well on that. So candida is more, remember, it's commensal in the gut, so it overgrows because conditions are right for it. So you need to change the environment as opposed to just going in and nuking it, which is obviously very appealing. But, otherwise what happens is you will successfully clear the candida, but it will just ping right back.
And one more question, please.
It would be great, actually, if you reflect on your experience on antibiotics like rifaximin versus the natural antimicrobial.
Yeah. Okay.
The other question is, can you use the antimicrobial at the same time with the probiotics?
Okay, so your first question is my experience of rifaximin and my thoughts on it. Okay, so I'm actually, I'm very comfortable with rifaximin from the point of view of it doesn't have a lot of the characteristics associated with conventional antibiotics, insofar as it's considered to be poorly absorbed, which means that it's retained about 97% within the gut. It doesn't travel systemically around the body. It also is broken down by bile. And as it travels along the small intestine, it gets more and more broken down. And then the remnants of it have actually been shown to be prebiotic in the large intestine. So those are the main reasons why we don't like antibiotics, because they have negative effects, they're broad spectrum. So rifaximin seems very good in that way. The bugs don't appear to be resistant to it either. And I've seen studies where they've done 5 rounds of rifaximin back to back, and it's been well tolerated and the bugs have not got resistant. So quite a lot of my patients will do at least 1 round of rifaximin, because they might have a GP, or they might have a private arrangement, or they have sourced it via some other means. Rifaximin is available over the counter in many places in Europe, for example, and actually India and other places. So some people, get hold of it of their own volition. And I quite often will kind of wrap my recommendations around a rifaximin prescription. Remember also that 2 weeks of rifaximin is equivalent to 4 weeks of herbals. So you can kind of understand why someone would find that appealing to do. So your other question was taking probiotics alongside antimicrobials. I think the important thing is to space them apart. So I always think about 2 things. So when someone's taking antimicrobials, I kind of have them do those in the daytime, and I often put probiotics in at nighttime, or at least an hour apart. So I might put in an antimicrobial at breakfast, lunch and dinner, and I might put in a probiotic mid-morning, mid-afternoon and bedtime. And studies have shown that actually even dead probiotics are good, and they still confer a benefit to the immune system. So they're still effective, they're not useless, and some will still survive. So I think there's still a value in combining them. So, good question.
And in terms of asthma treatment, would you, I mean, if the individual, it's a child, and she has been prescribed to take the steroids, little bit of steroid inhaler every day, and you're still supporting her with all the gut healing protocol, would you allow her to take the inhaler daily, or would you rather do the prevention yourself from the point of nutrition?
Yeah, my concerns with steroid inhalers are that steroids suppress the immune system, you know, and asthma is associated with dysbiosis, and I think there are strong links with Candida for that very reason. So the last thing you want is any prolonged period of immune suppression. So I would say natural all day long, you know. So I'd work on things like get her gluten-free, dairy-free, nice clean diet, lots of colour. With asthma, think antioxidants, so phytonutrient spectrum. With a child, eat a rainbow every day, you know. So work on the kind of flavonoid perspective, I think, is really powerful. And I'd look at things like raising immune defences in the nasal passages, in the mucous membrane. So I look at things like Saccharomyces boulardii and colostrum as being really important things.
What about mushrooms?
I haven't used mushrooms a lot, but I understand that they are really effective at modulating the immune system. So I would think that would be a good idea.
What about NAC?
NAC is great. You're thinking more from a respiratory perspective. Yeah, absolutely. Yes. Yeah.
Thank you.
Pleasure. Oh,
Hi, Tracy. Thanks
Hello.
for your talk, by the way.
thank you.
Just from a process point of view, can you clarify the two cases that you presented? How many times did you actually sit in front of them face to face? And do you offer email support? I know obviously you don't want to give away all your secrets, but yeah, just interested in terms of the interactions you're doing. Obviously a lot of tests, you're giving a lot of supplements. So
Yeah.
just, yeah, keen to understand from a process side how you work as a practitioner.
Yeah, okay. I've seen each lady 4 times. Yeah, 4 times. Support outside of consultation, I try and discourage as much as possible, simply because I feel it's unsafe. I don't know how many times, and you've probably all done it too. And you know, sometimes when you've got emails that build up in your inbox, and maybe you're on the train and you're on your way into clinic or doing something, and you think, oh, I'll get some emails done. And someone will write and they'll say, oh, you know, I'm bored with breakfast, what could I have? And you just think, oh, and you write, oh, what about this lovely overnight oat recipe? And then they come right back at you and they say, well, I'm allergic to oats. And you think, oh, if I was in the office and I pulled your file out, I would have picked up on the fact that I'd written no oats on your file. But because I'm doing it on the fly, and I think I'm being smart, and I think I can remember enough to answer your question, I go and give an answer that's unhelpful. And I explain that to patients, and I actually have a disclaimer on my written report that I do for a patient, and I just say, you know, I can only deal with short queries like, can I eat bananas, on an email. Anything more involved, and we may suggest that you book in. And I do what I call 20 and 30-minute check-ins via Skype or phone. And I'll charge them because they're going to pay for my time, but I will make sure that for that 20 minutes that I'm speaking to that person, I've looked at their file just beforehand, so I don't make the mistake with the porridge oats that I would have done ordinarily, and I'm kind of in their zone. So then they've got me, and I'm fully, you know, on the page as far as being able to make the right recommendations. So I think that's really important that people understand that. You always get some people that will send you an email which is basically a consultation by stealth. You know, oh, I've got all this going on and this has happened and so said this and I was reading this and da-da. And with those people, I go, thank you very much for your update. How would you like me to proceed with this? Would you like us to discuss these points at your next consultation? To that end, I notice we don't have a date in the diary. I could see you on this date and that date. And that's how I like to proceed. Patient boundaries is so hard.
Hi, everyone. I know questions lead to more questions. It's frustrating, but to keep everything on track, we're going to take a short 15-minute break in Balmoral 3. Teas and coffees there. But if you didn't get a chance to answer your question, don't panic. Tracy's very nicely going to be with us all day. And to finish the day off, we have a 45-minute Q&A session. So you'll get a chance to answer all your questions then. Thank you very much.
Thank you.